Hello, I'm Carlos Martinez. I'm a second-year plastic surgery resident here at Prisma Health.
Hey, my name is Tarek Majadzik. I'm a first-year plastic surgery resident here at Prisma Health.
Here at Prisma Health, they have a wide variety of specialties. So we have hand surgery, microsurgery, head and neck reconstruction, breast reconstruction, cleft craniofacial, aesthetics, and all these are important parts of a truly integrated program, and being here allows me to be fully immersed in those subspecialties and come out with a comprehensive education.
Prisma Health being a level 1 trauma center, you do get a fair amount of trauma. We get a lot of facial fractures. We get extremity trauma that needs complex reconstruction, and we have a certain level of collegiality here between specialties that deal with trauma patients, and plastics is a big part of that.
The nice part about our program is that we have a very small faculty to resident ratio. Many times we are working individually with the attendings on these complex cases, whether it's microsurgery, whether it's cleft palate craniofacial, whether it's hand surgery, even aesthetic surgery. We're only residents. Obviously, if there's like a larger case that's more involved, there are more residents that come in, but there are no fellows here. There are no other people that you're trying to sort of compete with. And the nice thing about our program is that since we're a close-knit group, we know what each other needs to do, and we have a nice respect for each other that says, you follow this patient for a long time, you get this case.
My name is Elliot Chen. I've been here for 12 years. I am the medical director of the cleft and craniofacial team. We have a very close relationship between the attendings and the residents. They work with us on an apprenticeship model where they work with us one-on-one. They get to see us how we run clinic, how we see patients afterwards, and they see the preoperative planning and how we would operate. As they get a little bit more mature in their years, they get to take over the reins more and be much more independent in the operating room. With a lot of private guys working along with us, it means that the residents get a lot of exposure to both the academic and the private world, and also get to work hand in hand, one-on-one with the private attendings as well. This gives them an opportunity to see how practices are built and how billing is done, things that we can't teach them that well in the academic world.
In the 6 years here that you spend as a plastic surgery resident, you really will be ready to be able to tackle any problem thrown at you as an attending once you get done here. And even as an intern, now finishing up my first year, I feel like I've gotten so much experience.
Columbia is a nice town. It's small, but it has a wide variety of people here. The food is great. I love going to coffee shops in the city. Living here, the beach is only an hour away. The mountains are only an hour away. If I ever want to go to like Charlotte or Atlanta just for like a weekend, I can, and it's so accessible. The nice part is Columbia is such a low cost of living. I can have a really nice quality of life.
When I'm on plastics, it's like every day is a new cool case to look forward to. And you want to see the attending you're working with because they're gonna try to teach you something new. They're gonna let you do a lot in the operating room. They're gonna teach you about the patient, how you tackle the problem, and you feel like you're gonna come out of it with something new you're gonna learn, and how to be a better doctor.
Residencies, I think you should go to some place that offers you the most experience to grow. And you need to be given a fertile ground in which you can just really develop yourself. And I think it's important to be able to develop yourself in a lot of different ways. You need to be able to operate well. You have to be a good doctor. You have to be able to be a good communicator in terms of being able to communicate really difficult information to patients and their families. You have to be able to grow as a person, and you need to understand both how business, medicine, artwork, and science all come together for plastics. Our philosophy is that everybody should be able to do everything, even though we're all subspecialists in our own particular field. As a craniofacial surgeon, I do all the complex face fractures, but all of us can do face fractures. I can do the hand surgeries, but Dr. Majadzik does the complicated ones. And same thing for microsurgery, with Dr. Gilstrap's practice and breast reconstructions. So I expect that to see the same for the residents, that they should all be able to do everything. And in the future, maybe they'll like to subspecialize in just one particular thing. When we graduate here, you'll be able to do everything.